My name is David Jacofsky. I'm an orthopedic surgeon by training, and I'm also the chairman of the Core Institute. So my primary specialty is really twofold. I take care of patients that have orthopedic tumors, bone tumors, soft tissue tumors, tumors called sarcomas. They're not all that common, luckily, and so when we're not taking care of tumor patients, the other thing that I specialize in are knee and hip replacements, primarily focusing on what's called a revision hip replacement or a revision knee replacement, meaning that a patient's had a total joint replacement done elsewhere, they have problems with it, whether it's because of infection, mechanical failure, or instability generally, and then they will come to see us to have that joint replacement redone. And it's very important that when you speak to your surgeon, you talk about exactly what you want to be able to do after surgery, whether the goals that you have are realistic, and whether or not you really are an appropriate candidate for surgery based upon the current functional limitations that you have and how much pain you have. If a patient came in and told me he wanted to run 100-mile ultramarathons after a joint replacement, I would probably encourage that patient to not have surgery and to continue to just run the 15 miles that they're currently able to run. On the other side of the spectrum, I often find myself almost trying to convince a patient that is truly functionally disabled, unable to carry out activities of daily living, take care of themselves, and even get up to go to the bathroom from bed at night without the assistance of a wheelchair, solely because of arthritis pain. And those are patients where you will profoundly and fundamentally change not only their pain, but the entire trajectory of their life, because these patients that become so inactive and debilitated end up with other complications. They become more obese, they can have cardiovascular problems, they develop heart disease from being inactive. And so sometimes joint replacements are intended to not just replace the joint, but to also allow you to, through keeping life in motion, develop better cardiovascular health, control your diabetes better, and those sorts of overall aspects of health and wellness related to being active. Without empathy and compassion, without treating the patient like they're a member of your family, somebody that you really need to help and want to help, you really become very little more than a technician. And there's a big difference between a technician and a physician, in my opinion. And ultimately, I think that at the Core Institute, we've done a phenomenal job doing that. We've created systems to help the doctors eliminate the noise and really focus on what's really important, which is the patient that's sitting in front of you. And I think at the end of the day, that's probably why our doctors are so much more exceptional at caring for patients, why our outcomes are so much better than everybody else's.